Assalamualaikum. Salam sejahtera and good day. Today's session is on the forearm muscle or muscles of the forearm. The objective is to recognize, to memorize the origin, insertion, and function of forearm muscles or muscles of the forearm antebrachial region. Okay, so similar to arm muscle, the forearm muscle are also grouped into common flexors, extensors. Okay, flexors at the anterior compartment of the forearm, while extensors are at the posterior compartment of the forearm. On top of that, on top of the two groups, the forearm muscle has extra group, which is called the other group, okay, others group. And this include the supinator muscle, pronator muscle, and as well as abductor muscles. Okay, now we will look at one by one, and we will look at the anterior compartment first. Okay, anterior compartment first. The anterior compartment of forearm muscle composed of the flexor muscles. Okay, in flexor muscles, it is subdivided into common flexors, other flexors, and other group of muscles. Okay, what are the common flexors? Common flexors are a group of muscles that arises or originate from the common bone marking, and they are arising from or originating from the medial epicondyle of humerus. Medial epicondyle of humerus. So the common flexor tendon has few things in common. They share the same characteristic. Number one, the first characteristic is they originate from the same origin, that is the medial epicondyle muscle. Number two, most of them helps in flexion of the wrist joint. Flexion of the wrist joint. In fact, they form agonist. This group of muscle form an agonist of wrist flexion. And number three, most of them are usually superficial layer of the forearm muscle. Okay, superficial layer of forearm muscle. Now we want to get to know what are the muscles that are included in common flexor muscles. There are 5 muscles which is in this group, the common flexor. What are they? They are, number one, the pronator teres muscle. The pronator teres muscle. Okay, pronator teres muscle is the only common flexor muscle that do not help in wrist flexion. Okay, it is actually the main pronator of proximal radioulnar and joint. Proximal radioulnar joint. Okay. Now, second muscle that is in the common flexor group is the flexor carpi radialis muscle. Flexor carpi radialis muscle, or FCR. Okay, FCR. Then we have the palmaris longus muscle. Palmaris longus muscle. And we also have the flexor carpi ulnaris muscle. Flexor carpi ulnaris muscle. So all these 4 muscles, which is in the common flexor muscles, are actually superficial layer muscles of the forearm. On top of these 4, there is another muscle that is in the middle layer of the anterior forearm muscle that is known as the flexor digitorum superficialis muscle. Flexor digitorum superficialis muscle, or FCU. Okay. Now, remember, common flexor, there are 5 muscles. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis muscle. All these 5 muscles origin dia sama, iaitu medial epicondyle of humerus. Insertion sahaja yang berbeza. Jadi you hafal insertion sahaja. Di mana pronator teres inserted at the lateral border of the radius. Okay. Flexor carpi radialis inserted at the base of the second metacarpal bone. Flexor carpi ulnaris inserted at the base of the 5th metacarpal bone. Palmaris longus inserted in the palmar aponeurosis of the hand. palmar aponeurosis of the hand, and the tendon of palmar aponeurosis ends or insert at the shaft of the proximal phalanges, second, third, fourth, and fifth digits. Okay. The flexor digitorum superficialis muscles, the tendon inserted at the head or at the at the middle phalanges of second, third, fourth, and fifth digits. All right. The function of all of these common flexor muscles, except for pronator teres, is to flex the wrist. Flex the wrist. Okay? Flexion of the wrist. However, in addition to that, flexor carpi radialis and flexor carpi ulnaris, when they work together, when they work in singular, meaning they contract itself only without the rest of the group members, the FCR or flexor carpi radialis will cause radial deviation. Radial deviation. This is also known, some book also say this is considered as ABD, abduction. Okay, but I do not prefer abduction because abduction dia akan confuse dengan lower limb nanti. So I prefer to use the term radial deviation when it works singularly, meaning it contracts only on its own, flexor carpi radialis. Begitu juga dengan flexor carpi ulnaris, when it contracts on its own without the rest of the group member, it will cause ulnar deviation of the wrist. This is also known in some book, they called it as ADD, adduction of the wrist. But I prefer to use the term ulnar deviation done by flexor carpi ulnaris alone, radial deviation done by flexor carpi radialis alone. Together, all these common flexors, when they work together, they cause wrist flexion, except for pronator teres. Pronator teres, the job is to do pronation. This one, pronation. Okay, pronation. Pronation at the proximal radio-ulnar joint. Pronation at the proximal radio-ulnar joint. When you do pronation at the distal radio-ulnar joint, that is done by other pronators, nanti kita tengok. Okay, now kita nak tengok apakah flexors yang lain yang terdapat dalam anterior compartment of forearm. The other flexors are the flexor digitorum profundus, which is the deepest layer of forearm anterior compartment muscle, as well as flexor pollicis longus. Okay, flexor digitorum profundus and flexor pollicis longus. Flexor digitorum profundus arises from the interosseous membrane, okay, of the radial ulnar joint, and also the shaft of the ulna, and it inserts itself at the distal phalanges of all digits. Okay, distal phalanges of all digits except for first digit. Okay, except for first digit. Kenapa? Sebab first digit is special. Dia ada its own flexor muscle. The name is flexor pollicis longus. Flexor pollicis longus. The word pollicis refers to pollex. Pollex means your first digit. Okay, and flexor pollicis longus or FPL arises from the shaft medial surface of radius. Okay, and ends at the distal phalanx of first digit. Okay, right. What is the function? The function is again flex. Flex what? Flex the wrist, and of course flex the digits. At where? At the DIPJs. Okay, DIPJ, distal interphalangeal joints. Okay, distal interphalangeal joints. I forgot the other one, the flexor digitorum superficialis. Is, apart from flexing the wrist, it also helps in flexing the proximal interphalangeal joint. Proximal interphalangeal joint. Okay, proximal interphalangeal joint. Right. Now, kita tengok apakah muscle yang lain selain daripada the common flexors and the other flexors. There are other group of muscles which are known as the pronators. Okay, they are known as pronators. Ada dua pronators di dalam anterior compartment of the forearm muscles. And number one tadi kita dah kenal dia sebagai one group member of common flexor. Kenapa? Sebab walaupun dia tidak flex the wrist, tapi dia berasal daripada origin yang sama iaitu medial epicondyle. Jadi pronators yang pertama ialah pronator teres. Okay, pronator teres. Tadi kita dah kenal dia, okay. Now another pronator is pronator quadratus. Pronator quadratus, okay. Look at the position of these two pronators. The pronator teres is located at the proximal part of radial ulnar joint, while pronator quadratus is located at the distal part of radio-ulnar joint. So pronator teres causes pronation at the proximal radio-ulnar joint, while pronator quadratus helps in pronation at the distal radio-ulnar joint. Fungsi dia sama, to pronate, from supination to pronation. Dia tak boleh pronate proximal part saja without pronation of the distal part. Nanti kita akan angulated the radius and ulnar bone and fracture. So kita kena pronate dua-dua, proximal and distal part. But because the pronator teres is very short, so dia akan pronate the proximal part saja. That's why God created another pronator at the distal part, which is called the pronator quadratus, and it pronates the distal part. And it works together simultaneously. Okay, it cannot work alone, because if it works alone, you will fracture you punya radius ulnar at the shaft. Okay, now pronator quadratus, nama dia quadratus kan, so bentuk dia adalah segi empat. Okay, segi empat tepat lebih kurang. Where is the location? At the distal part of radial ulnar joint. The origin is at the anterior surface of the radius, distal part, and insert at the anterior surface of the ulnar medial part. Okay, anterior part. All right, so this is the diagram. If you want to refer to your Natus clinical key, it shows the superficial muscle of anterior compartment forearm muscle, where you can see clearly the pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis. Daripada 5 muscle ini, ingat 4 adalah tergolong dalam superficial layer of forearm anterior compartment muscles, iaitu pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Flexor digitorum superficialis is included as intermediate layer ataupun middle layer of anterior forearm compartment muscle. Okay, the common characteristic is, number one, it arises from the same origin, that is medial epicondyle of humerus. Okay, and then 4 of the 5 muscles, they produces flexion of the wrist, and 1 muscle, that is pronator teres, they produces pronation of the proximal radio-ulnar joint. Flexor carpi radialis and flexor carpi ulnaris, if they work in singular, they will cause radial deviation and ulnar deviation respectively. Okay, so in this in this picture, in this diagram, you can see how flexor digitorum superficialis is located. It is actually the intermediate layer. It is underneath the palmaris longus and also flexor carpi radialis muscle. Now kita tengok bahagian belakang, posterior compartment forearm muscle. Di dalam posterior compartment, dia sama macam arm, ada extensor muscles. And in the forearm, kita subgroupkan lagi, dia ada common extensors, other extensors, and other group of muscles. Okay, sekarang kita tengok common extensors. Kalau tadi dalam anterior compartment, kita ada common flexor, dalam posterior compartment, kita ada common extensor. Apakah perbezaan dia? Perbezaan dia ialah common flexor arises from the medial epicondyle of humerus. Tetapi common extensor arises from the lateral condyle of humerus. Lateral epicondyle of humerus. Lateral dia parallel dengan thumb. Okay, lateral dia parallel dengan thumb. Medial dia parallel dengan little finger, the fifth finger. Okay. So common extensors, they share the same characteristic. That is, number one, they originate from the lateral epicondyle of humerus, and they form the same action, that is to extend the wrist. Extend the wrist. Okay, what are the muscles? Sama kalau common flexor ada 5, common extensor juga ada 5. Ya, kita tengok satu-satu. Apakah muscle-nya? Number one, brachioradialis muscle. Brachioradialis muscle. Okay. Walaupun brachioradialis muscle ini tidak originate daripada lateral epicondyle of the humerus, it does help in wrist extension. Wrist extension. Okay. And it also helps in radial deviation. Radial deviation when it works together with flexor carpi radialis muscle. The brachioradialis is the only muscle of common extensor group that arises from the from the lateral border or anterolateral surface of the distal 1/3 shaft of humerus. Okay. Right, the next muscle, the other 4 muscles are the extensor carpi radialis longus muscle, extensor carpi radialis brevis muscle, extensor digitorum muscle, and extensor digiti minimi muscle. All these 4 arises from the or originated from the lateral epicondyle of humerus, and the extensor, the insertion is a little bit different from one to another. Now let's see where they inserted. The extensor carpi radialis longus muscle inserts its tendon at the base of the second metacarpal bone. At the base of the second metacarpal bone. Extensor carpi radialis brevis pula will insert its tendon at the base of the third metacarpal bone. The extensor digitorum muscle inserts themselves at the extensor retinaculum and extensor hood. Okay, extensor hood. All this tendon, all these fibrous sheath, they akan form the hood, macam bumbung yang menutup the dorsal part of the hand. Okay, so and the end of the tendon of extensor digitorum, dia ada 2 insertion. Pertama dekat distal phalanx, kedua dekat middle phalanx of second, third, fourth, and fifth digits. Okay, right? And then kita tengok extensor digiti minimi. Extensor digiti minimi inserts itself again at the extensor retinaculum and extensor hood. It also inserts itself, the end of it, at the distal and middle phalanx of the fifth digit. Okay, right? So kerja dia apa? Kerja dia nombor 1, extend the wrist, and the extensor digiti minimi extend the digit at the DIPJ and PIPJ. Extensor digitorum extend all digits second to fifth at the IPJs and also PIPJs from second, third, fourth, and fifth. Alright, you notice thumb tidak terlibat. The first digit tidak terlibat sebab dia ada extensor yang special. Okay. Alright, extensor carpi radialis longus and extensor carpi radialis brevis will also extend their wrist, and when they work together without the other 3 muscles in the common extensor group, it will also help in radial deviation of the hand. Radial deviation of the hand together with brachioradialis and flexor carpi radialis muscle. Now, flexor carpi ulnaris, salah satu lagi yang last, grup yang terakhir dalam common extensor muscle, arises still again from the lateral epicondyle of humerus, and it ends itself at the base of fifth metacarpal bone. Base of fifth metacarpal bone. So kerja dia is to extend the wrist when they work together as common extensor, and also causes ulnar deviation. Ulnar deviation. It works together with the flexor carpi ulnaris. So untuk deviation, ulnar deviation, flexor carpi ulnaris, flexor carpi, flexor and extensor carpi ulnaris. Untuk radial deviation, flexor and extensor carpi radialis plus brachioradialis. Ingat ya? Untuk digitorum dan digiti minimi, extend the wrist and extend the IPJs and the IPJs of second to fifth digit. When common extensors work together, they cause wrist flexion. Boleh ingat eh? Okay. Now, what are other extensors that are present in the posterior compartment of forearm muscles? There are three other extensors, and these extensors basically involving the thumb, sebab tadi kita tak sebut langsung extensors yang menyebabkan pergerakan first digit kan, semuanya second to fifth digit. So sekarang kita nak concentrate pada thumb ataupun pollex, first digit, dan juga extensor indicis, second digit. Now, we have the extensor pollicis longus, extensor pollicis brevis, and also extensor indicis. Okay. As the name implies, you know already that extensor pollicis longus and extensor pollicis brevis both will move the thumb. Okay, tengok longus. Longus, dia berasal daripada interosseous membrane dan juga the lateral border of ulnar shaft, and then it insert itself at the distal phalanx of first digit. While yang brevis, yang pendek, they insert itself at the middle phalanx of, not middle phalanx, proximal phalanx of first digit. Okay, yang panjang pergi jauh, yang pendek pergi yang dekat. Yang panjang pollicis longus pergi dekat distal phalanx, yang pendek pergi dekat proximal phalanx. Okay, kedua-duanya berasal ataupun originate from the interosseous membrane of the radial ulnar joint. Okay, dan juga kalau pollicis longus tu just a little bit at the lateral border of ulnar sikit je. Kerjanya apa? Kerjanya extend. Extend apa? Extend this IPJ. Okay, interphalangeal joint. Interphalangeal joint. Okay. And it also extend your MCPJ, metacarpophalangeal joint, yang first digit. Okay. Right. Satu lagi extensor ialah extensor indicis. This one is special untuk jari second digit, jari telunjuk. Okay. Extensor indicis arises from the interosseous membrane of radial ulnar joint at the distal part, and it inserts itself at the base, okay, of the base of second proximal phalanx. Okay, at the base of second proximal phalanx. So you can imagine when they pull dia punya fiber, dia akan extend dia punya MCPJ, second digit MCPJ macam ni. Okay, that's why this finger is stronger than the rest of the other finger in terms of extension, because dia ada extensor digitorum, dia juga ada extensor indicis. Okay, extensor digitorum dan juga extensor indicis. This one and this one, dia memang lebih kuat daripada yang lain. Okay, now the other groups are the supinator muscles and also abductor pollicis muscle. Okay, abductor pollicis muscle. supinator muscle for supination, okay, supination, and abductor pollicis muscles insert sama dengan tadi, dengan extensor pollicis brevis, iaitu dekat base of metacarpal first digit, and dia punya kerja adalah abduction. Abduction saya dah tunjuk dulu kan? Yeah. ABD. Okay, dia tarik dekat base of metacarpal, abductor pollicis. Extensor pollicis brevis, base of proximal phalanx. Extensor pollicis longus, base of distal phalanx, like that. Okay, abductor, extensor pollicis brevis, extensor pollicis longus. Extensor kerjanya extend ke belakang, abductor kerjanya ABD, jauh daripada webbing ni. Okay, right? So supinator kerjanya to supinate like this, pronate like this. Okay, alright, sampai situ sahaja. And then, okay, habisnya August. Extensor indices, supinator. Now, what are other group? Actually, saya dah sebut supinator, saya dah sebut abductor pollicis longus. Saya cuma tinggal nak sebut, satu lagi muscle, iaitu anconeus muscle. This is the posterior compartment forearm muscle. Ada satu lagi superficial layer yang dia sebut sebagai anconeus muscle. Okay. Anconeus muscle ini, setengah buku masukkan dia sebagai common extensor sebab dia berasal ataupun origin dia sama dengan common extensor, iaitu lateral epicondyle of humerus. Tetapi oleh kerana dia very short and it doesn't produces major movement, some books do not consider it as common extensor. But this is a debate between academicians. You don't have to worry about it lah. Just know that there is another muscle called anconeus muscle, origin at lateral epicondyle humerus, insert at the olecranon process of the ulna. It helps a bit only in elbow extension, because when they pull dia punya fiber tu, dia akan helps in elbow extension, but very little dia punya movement, very little sebab dia very short muscle. Okay, apart from that, you have the supinator muscle I've mentioned earlier just now. Okay, the job is to do supination, and you have abductor pollicis muscle. Abductor pollicis muscle origin dia from the posterior ulnar shaft, and then it ends at the base of first metacarpal bone. Okay, so it abducts like that. Okay, so that's it. Again, what I want you to do is to go back to your Netter's clinical key, take out the diagram on the bone. Here, I'll show you. I'll just share with you muka surat. Dalam Netter's clinical anatomy, you boleh buka daripada muka surat. Okay, muka surat ni 32, okay. At page 32, your clinical key, Netter's clinical key, there is a picture, a diagram of your radius and ulna. Okay, radius ulna together with its interosseous membrane. Okay, so again, what I want you to do is try to draw this, okay, without labeling the bone markings, and try to draw the origin and insertion of these muscles, okay. But in this case, because dalam forearm ni kebanyakannya dia akan involve medial epicondyle kan, so you lukis sedikit sahaja the distal end of arm, the distal end of humerus, whereby you can see the lateral epicondyle and medial epicondyle. This is to help you in to help you in remembering the origin for um, common flexor and also common extensor muscles. Okay, so the rest of it you can do as what you did in arm and previously and shoulder girdle previously. So this helps you a lot in memorizing. Okay, thank you very much and see you in next session. Thank you.